My name is Samara Swanston. I'm the Executive Director and General Counsel of the Watchperson Project, Inc. of Greenpoint, Williamsburg. The Watchperson Project was created out of a fine levied by the State Department of Environmental Conservation against the City Department of Environmental Protection for violations of the Federal Clean Water Act at the Newtown Creek Sewage Treatment Plant. The fine was devoted to environmental benefits for the community at the insistence of the community. And the Watchperson Project was one of the projects that was suggested for funding by a community committee. The Watchperson Project was intended to support community interest, activity, education, and activism, a capacity building resource organization. We notify the community of environmental permits that are coming up, permitting processes that they should be involved in. So when we found out that there were 13 major sources of air pollution that would require a new Title V permit, we sent a letter listing the sources to all the community organizations that we could find so that they can participate in the permitting process. When we found out that USA Waste had proposed a new waste transfer station over there on the waterfront, we submitted lengthy comments to the New York City Department of Environmental Sanitation, 10 pages of comments on the problems in the environmental assessment. We represent the community, so when we saw that the state was planning a change in the state implementation plan for the Clean Air Act, we both commented on the state implementation plan, they call it a SIP. We went to a public hearing on the SIP. Then we saw that they were planning to eliminate the clean fleet fuels provision for heavy-duty trucks. That's part of the state law, and we have a lot of heavy-duty trucks in our community. We went to the hearing and testified in opposition to that proposal by the state. We noticed in the environmental notice bulletin that they were planning a new, what we consider a major source, a power generation plant in the Brooklyn Navy Yard. There's been a lot of struggle around this community about incinerators, and a power plant is just another name for an incinerator. They burn fuel to generate energy. We've been extremely opposed to burning garbage to generate energy, and the Watchperson Project has been sort of lifting up that issue to recognize that if we have regional power generation that is large, that's almost the equivalent to having a regional garbage incinerator. The community is beset by environmental problems, so we serve as an environmental ombudsman. If somebody calls up and says, oh, there's a metal plating facility venting emissions into our bedroom, we call DEC and say, can you get an inspector out there? If somebody calls and says they're doing a building demolition and we think there are lead contaminated soils blowing into the community, we call DEC and get an inspector out there. So we try to resolve community problems. We try to act as an environmental ombudsman, a community advocate, environmental educators, and we keep an eye out for environmental benefits, because New York City went out and voted overwhelmingly to get the Environmental Bond Act passed. Our community has less than a half acre of open space per 1,000 people, desperately underserved by open space. And it's a community that has a third of the waste transfer stations in the city of New York. And the stars represent waste transfer stations. All 30 of them are not on here, but you can see that there are many, many stars in our community. We have a third of the city's burden for waste transfer stations. These big yellow facilities on the map are right-to-know facilities, facilities that use, generate, dispose of, or store hazardous materials. We also have mapped toxic release inventory facilities, which are facilities that are required under federal law to disclose what toxic materials they use and release, whether it's air emissions. We have a big problem with air quality in our community because we have more than 2,000 permitted industrial facilities that emit air pollution. And so between that and the mobile sources emissions from the waste transfer stations and from the highways and the traffic that leads to the Free Bridge, to Williamsburg Bridge, we have a lot of air pollution, and we have a big asthma problem in our community, which is why I think the Department of Health selected our community to be part of the Childhood Asthma Health Initiative. There was a 1993 health study done on our community that found we were #1 in the city for stomach cancer. So we have a number of statistically significant elevated levels of cancer, childhood cancer, leukemia, and these cancers, we'd like to see the work done to see if they are related to our degraded environmental quality. In addition, the Watchperson Office has developed a proposal to have annual training of the Greenpoint and Williamsburg police in enforcing environmental crimes. We found in our research that the police have the authority to enforce both the environmental conservation law, the sanitation law, and even federal laws when they see criminal violations of environmental law. And what we've put together is a collaborative in which DEP, and we can get people from the environmental conservation police come together to sit down with our local police and sort of tell them what they're authorized to do, and we're going to make community folks aware of what they're authorized to do. So we believe that education and capacity building will make for a cleaner environment, because when the community knows what's illegal, then they can stop things. But we have mapped both demographics, old housing, lead-poisoned children, the presence of trees, the presence of environmental facilities, vacant lots we've mapped, and we have 30 sets of data on the community which serve to help community residents who come in here and look at our GIS and look at our maps to sort of understand what the threats are and what the potentials are for improving environmental quality. Now we're entering our Geographic Information Systems Lab, which is downstairs in the People's Firehouse, located at 113 Berry Street between North 7th and North 8th. And this is Lise Eisenberg, who is a consultant from DEP and also a very progressive, community-orientated person. And she's working on our geographic information system right now. We are updating our databases. We are generating new maps. You can see some of the maps that have been generated throughout the years in our program. And what we are hoping to do is we expect to be getting a new GIS, so we'll have really 2 stations. We're going to train community activists in using the GIS so that they can sort of spatially represent what's happening in the community. I believe in the power of the GIS, but you have to realize the GIS is just a map, just data. What's valuable is how you use it in solving environmental problems and evaluating environmental threats and risks and doing community planning. For example, if you look at this map, this is the city-owned properties in Greenpoint, Williamsburg. And I think we have more vacant city-owned land in Greenpoint, Williamsburg than any other community. Or so the City Department of Environmental Coordination is telling us. This is a map of waste transfer stations by census district. It is being, I think we're going to update it right now because we have more waste transfer stations that are represented on this map. This is a map that we recently generated with one of our new software pieces on cancer incidents. And the darkest map areas are the places with a lot of cancer incidents. And I think there's some relationship between those and the location of petroleum storage facilities. If you look at here's a map with the location of major oil and bulk petroleum storage facilities. And if you can compare the 2 maps, you can see dark spots near these petroleum storage facilities. Petroleum byproducts and petroleum streams have a number of carcinogens, which if inhaled over a long period of time can cause cancer. The recycling contracts for all of Brooklyn and Queens, waste transfer stations accepting waste that is greater than the amount of waste daily, currently accepted by the Staten Island landfill. Significant power generation facilities. We're doing regional power generation, which of course creates air emissions. Major infrastructures like highways and expressways going through the communities, infrastructure features which bring us air pollution, and very few environmental quality benefits. We also have over here a terminal that is devoted to internet access for the community. So we've bookmarked a number of environmental sites so they can go online and get the information from the federal sources. They can get demographics information, they can get environmental information, they can obtain grant information, they can obtain health information, and all of that information is important in decision making. People constantly come in our office and say, I'm going to buy a house here, I'm thinking of moving here. Can you tell me if there are any environmental disamenities, if you would, near where I'm planning to move? So we are the only community in the city of New York to have this kind of intensive data on our community. And I have to tell you that the Bronx Solid Waste Advisory Board said that the South Bronx needs a Watchperson Project. We've had international visitors that say you need a local environmental agency to have information and sort of help the community address its problems, because our community, being mixed industrial and residential, has unique problems not present in other areas. And we therefore have unique needs, and people need to be able to obtain information right away about the community. We have block and lock data on the community that will help us to go right down to your block, and we can tell whether you have a tree or not.
Everything that is in green, all of these are outlines of tax lots of city property. This is from the Atlas of City-Owned Property. So all of these are parcels currently owned by the city. We have streets, we have addresses, we have the block and lot ID, which is very important because much of the information we have is based on the parcel. Who owns it, how is it zoned, what was found on that site. Other things we have are incidences of cancer, which is done by census tract. We have lead poisoning. We have the block and lot of all the city parcels from the Department of City Planning. We have the bus routes. We have where the subway stations are. This is an aggregate of information from city, state, and federal sources. So most of it is public information, but this office is the only place where you can see all of this information layered one on top of the other for a neighborhood's uses. But as we're updating it, we'll be able to get more information. As you find more information, you can add it to any of these, and that's part of the beauty of this, is it's not static. If you decide that you need to know where tree locations are, and you can get a map of them, you can add a layer showing tree locations. As Samara said, with the Asian beetle infestation, we were looking at trying to map existing street trees, look at where street trees had been lost, and use that information to cite new trees when the Parks Department was coming for replanting.
But what Lisa's pulled up is the entire community board.
This shows the basic area, and the blue is the street map. Again, the pink triangles are the waste stations, and underneath the green is showing city-owned property. This is just a random choice of the various things that could be displayed. So you get some idea of how things are scattered throughout, and you can see that waste transfer stations all tend to be clustered in one part of the area, and down here there are none. So if you're looking for impacts relative to housing costs or to demographics, if you want to compare this to census tract and see is there a higher impact on the Hispanic community as opposed to the Polish community, or you want to bring up zoning, which we also have through the city, and find out how mixed use or industrial or residential compares, you can do that. And in some cases you can do it just eyeballing it and just looking at how the colors and the density changes depending on which layers you choose to show. That's why having a GIS is a very good tool for human use of information. It's much easier to look at a map and look at pictures with different colors than to look at a printout with pages and pages of addresses and numbers and densities. So this makes it very easy. And because you can query it this way, you can go and ask the system and say, all right, there's something near a waste transfer station, what is it? And you can see that this is 500-40 Kingsland Avenue. And it's an indoor storage and supplies, and it's owned by the New York Police Department. So being able to do this, you can see what things are close to one another. You can even let the software do that for you if you like, by looking at an area and creating a buffer zone around it. So you could pick a school, draw a 500-foot buffer, and then see if there are any waste transfer stations that are sited within 500 feet of a school or a synagogue or an empty lot you'd like to develop. And all of this, you need a map that has those distances and those locations. That's
All right.
a little bit better. Okay, the lead under cancer was not the right one. And now that's a little large, so let's...
I just asked Lise to bring up our mapping of lead-poisoned children. While not a complete representation of lead-poisoned children in our community, simply because more work needs to be done, you can see that we have numerous instances of lead-poisoned children in our community. The mapped cases here are lead levels in excess of 20 micrograms per deciliter. And that threshold has been abandoned by the Center for Disease Control. They now consider a child lead poisoned if your blood lead level exceeds 9 micrograms per deciliter.
All right, so this would have to be redone anyway.
This is a big underrepresentation of the lead poisoning situation in our community, but you have to realize that most of our housing has lead paint, because most of our housing predates 1940.
Another thing you could see from looking over here is that you have a cluster up here, you have more clusters here. You would want to look at the reasons for that. One thing you could do is you could look at demographics and say, well, maybe there are just more children over here than there are over here, and this is an older population. Or it's possible that this is older housing stock. So you would want to look at the information you have about buildings and say, all right, if this was newer development and this was older, then what we have is a lead paint problem. If it's proximity to the Williamsburg Bridge, we had a problem with...
This is proximity to the Williamsburg Bridge.
We had a problem with that because there was work being done on the bridge, which was restorative, but what it was doing was throwing lead dust into the air. So you can look and see if possibly you have a cluster and you can't explain it, and then start to look for what else is in the neighborhood and say, are they near a highway? Are they near a bridge where there's work going on? Is someone tearing down a building, putting up a building? Again, the age of the population, those kinds of demographics let you find out things that you wouldn't know otherwise. If you just had a list, you wouldn't spot anything.
Mm-hmm.
In a picture, you can say, why do I have them up here, but a little south of there, there's almost nobody?
Mm-hmm.
And then you can start asking questions.
Mm-hmm.
So sometimes this gives you the questions to ask instead of answering a question for you, and it can lead you into a path of inquiry rather than giving you back the answer you expect. And so it's an interactive tool. And you should not view it as static information. You should come to it and say, this is the information we have, let's see what picture it gives us, and then we can figure out where to go from here.
And the next initiative that the Watchperson is going to be engaging in is mapping asthma prevalence. This is something that really hasn't been done, but our community-based organizations are going to be conducting surveys so that they can get asthma attacks and asthmatics and their locations, and then we're going to geocode asthma prevalence the way we've geocoded lead-poisoned children. This will give us an opportunity to compare the prevalence of asthma with facilities that use asthma precursors or facilities that use occupational asthma triggers, and see whether or not outdoor air quality impacts on the prevalence of asthma in our communities. This work that really isn't being done. Most of the studies have looked at indoor problems or use of medication or genetics or other things. They haven't looked at how the air quality causes asthma exacerbation. We all know that asthma is an environmental disease. Is what are your patterns of exposure? Are you there being exposed to
Where are
the
you at
source that
school?
you're
Where are you
located?
at work?
Are you in your house all the time, or do you spend most of your time at an asbestos site, for example?
Right.
And by looking at that, you can tell whether they're being poisoned by local facilities, whether they're being poisoned occupationally.
Whether it's coming in, maybe it's going to follow one of those waste transfer
That's
station
right.
truck routes.
That's right.
Right. So you come down with one question and you think you got a pretty good idea of where the answer is. You may be surprised, but it may say, it's not where you think. Look
Right.
over here.
Well, we did find a relationship between people who live near the Williamsburg Bridge and lead-poisoned folks.
Which is no surprise considering the work that
So,
we're doing. But it allowed you then to go back to the city and
Right.
say, stop what you're
Right,
doing.
right. Make a change.
Right.
Make a change.
We see that there's trouble here and we can show you the correlation.
So it is possible to predict environmental disease incidents by looking at this and then excluding other confounders.
Right.
So, and
you
then
can do it
you
in both
document it with
direct-
biomarker sampling.
And you can use this both ways. You can say, I see we have lead poisoning. This leads me to think that it came from these buildings.
Right,
or you
right.
can say, I see that we have this kind of population in this kind of area. My guess is if we don't do some remediation, we're going to start to see new incidences coming up.
Right.
And it lets you go in both ways,
Right,
historically and into the future.
Right.
And the more years of information we get here, as we go into the future and as we
Right.
fill in some of the back, the better a predictive indicator.
Right, the
will
better
be.
we'll understand environmental disease, health risks, threats, places where we need environmental mitigation, places where we need environmental benefits. As we build on our database, we'll be able to make environmental quality improvements in the
That's
community.
right, and learn and be able to set priorities and be able to see if you can have a concerted attack where there may be one area of demolition and you might see lead and asbestos going
Right,
up
right.
and say, if we hit this, we kill two birds with one stone.
Right.
As we mentioned earlier, this is mostly government information from the EPA and other federal agencies, from the state, specifically DEC, the Department of Environmental Conservation, and from the city. And while DEP, the Department of Environmental Protection, was the lead agency in gathering the information here comes from the Department of Sanitation, the waste transfer stations, Department of Health. Census tract information is federal. So this represents your tax dollars at work in some very real way of how this information is gathered and correlated by different agencies. But it only becomes of use to the people in the community if they can get their hands on it and use it somewhere like this. And this is one of the reasons that things like the Freedom of Information Act and guaranteed public access to public information is important. This information is not intended to violate the rights of privacy of individuals. We have demographic information that tells us number of black and white and Hispanic and Asian people, but it's not down to the individual house. It's by census tract. When we look at lead incidents or cancer incidents, we're not trying to find who is sick and who is healthy. We're trying to find patterns of demographic and epidemiological studies. So it's a fine line between privacy and public access, but a system like this that can do a gross analysis of information on a community board area can be invaluable to all different manners of people in the neighborhood trying to do work.
So we're trying to get the word out for people who weren't following what was happening with the Environmental Benefits Program, on people who don't go to the community board meetings. And we do have a lot of people that know about what we do, and we want to increase that number because we're here to serve all 156,000 people that live in the community, whether they're Greenpoint residents, Williamsburg residents, or residents of those two zip codes that are in community District 1 that adjoin our community, that aren't quite Greenpoint or the Williamsburg zip code. And our job really is to make put citizens in a position to help themselves so that we no longer are the dumping ground for the city, that we don't have to feel beleaguered, that we don't have to feel that, we're going to get the shaft. Because if we have the information and we can put it in the face of the regulators, then they're not dealing with a sleeping community anymore. They're dealing with an alert community. And people at USA Waste and the government regulators, they want a sleeping community. They don't want to see 1,200 people turn out to a hearing because they realize they can't put anything over on a community. They want a community where they can shove things bad and the community just takes it. Well, hopefully with our work, this community will not be receiving any more bad things, and we can start demanding the good things that we need to have a quality lifestyle in Greenpoint, Williamsburg.